It is Black Maternal Health Week, a time that highlights the disparities in healthcare that are present particularly for Black moms.
Dr. Wendy McDonald is joining us now with more. Thanks for joining us because it's such an important conversation. Is it access to healthcare? Is it education? Is it all of the above?
It's all of the above,
okay.
And sprinkle in a little bit of bias and implicit, racism and implicit bias, because unfortunately there is a lack of education when it comes to what our bodies are doing, like our own self-awareness, but there's also a lack of listening to patients and listening to people who are having particular issues, recognizing signs of high blood pressure or preeclampsia, recognizing blood clots. Serena Williams had a blood clot and said, I don't feel right, and was ignored initially. Hemorrhage is one of those things that we have to act on quickly, and you can't just say, oh, she's fine. We need to make sure she's fine.
Yeah, and it really is a simple check. The numbers here are staggering, and I had to make sure I read this correctly so that I get it right. Pregnancy-associated mortality ratio was almost 6 times higher for Black women compared to white women, and 2 times higher for Latino women than Black women?
Yes, that's in Chicago. That was Chicago statistics. So the pregnancy-associated mortality is 98 per 100,000 women for Black women, which is in comparison to 17 per 100,000 women when it comes to white women in Chicago. Dying. And unfortunately, that's like 3 times the national average. It's pretty bad here. Now, there are some additional statistics associated with that. People who are of high school education or less are more vulnerable. People of lower socioeconomic status, so who make less money essentially, are more vulnerable, which means that we need to actually pay more attention to those communities, increase our surveillance, increase our education, and actually increase our information with regards to pregnancy prevention, because some of these pregnancies are not intentional pregnancies. So we also have to look at this as a multifaceted thing, and our providers need better education when it comes to racism and bias training.
And so what are some of the disorders that are affecting more Black women than they are white women?
It's high blood pressure, which can lead to preeclampsia. I myself was pregnant with my first son, had 0 symptoms, and had stroke-level blood pressures.
Really?
Stroke level. I was 26. I had no other risk factors other than this skin that I have, unfortunately. And so there are ways, though, to prevent that. Something as simple as a low-dose aspirin started at the first part of the pregnancy can help to prevent preeclampsia for those who are at higher risk, which are women of color who have never been pregnant before, who are, in certain categories. And that's something that we need to tell people. Like, people don't always automatically know that, or think like, oh, I should be just taking a low-dose aspirin every day. But providers need to be educating people, and patients need to understand, too, that this is something that's preventable.
I'm surprised at the number of women who don't seek medical attention when they find out that they are pregnant, because a lot of that could also be prevented.
100%, because so many things in pregnancy are silent. You literally have no symptoms. I told you myself, my 3rd pregnancy, I had something called cholestasis of pregnancy, which is a liver condition that can actually lead to stillbirth. No symptoms other than some mild itching that everybody in pregnancy has. How would I know? Because I got labs checked. How did I know I had preeclampsia? Because I had my blood pressure checked. Because I worked at a hospital. But if you don't go see your provider, and if your provider isn't watching for these things, and if you're not getting those checks, you may not know that you're at high risk.
Well, because let's face it, especially the first time you're pregnant, pregnancy's weird. Your body goes through weird things. You don't know what's weird or what's wrong.
Absolutely. Absolutely. You can think like, oh, this is just normal. There was a woman who passed away some years ago who said she could not breathe. She felt like her baby was crushing her from the inside. 3 days later, she was dead. She had a heart condition that led to that. But had she been seen and had her doctor investigated, that could have been prevented, So it's things like that that unfortunately we need to take this multifaceted approach in order to reduce these risks.
Let's go back to something else you talked about, education and pregnancy prevention.
Yes.
There are some preventative measures out there that are getting a bad rap.
100%. When we talk about birth control, it's like, ooh, booga booga, like you can't talk about birth control. However, there are very safe and effective contraceptions, birth control methods. And when we think about some of the risks associated with birth control, it's like, okay, there are risks of blood clots, there are risks of high blood pressure, but those same risks are like tripled or quadrupled in pregnancy. So it's like, which risk are we going to take? You know what I mean? And so it's just a matter of really heightening those conversations, improving trust, and just really getting deeper into those conversations, because otherwise we're just in the line of fire and don't even realize it.
Well, and I didn't even realize until I was much older that there's hormonal and non-hormonal methods of birth control.
Yes,
Stu.
there are completely non-hormonal contraceptive methods. There are hormonal ones, obviously. There are some that are implants, some that you take, some that you just use at the time of, the party. You know what I mean? So it's like you really can, and you can pick whatever choice you want as long as you know that you have choices.
Yes. Oh, that's the whole key. Education. Dr. Wendy Preach. We love it. Check her out on social media. She's always got a good story to tell. And in a way that you'll walk away smiling. I love it. Dr. Wendy, thanks so much. You can see her on Dr. Every Woman social media handles, loopobgyn.com also.
Thank you.